Hello everybody, I am Dr. Stephanie Freese. I am the owner and veterinarian of Polaris Equine Mobile Veterinary Clinic, and I'm also the veterinarian seat at the Chatham Board of Health. Today I will be talking to you about COVID-19. COVID-19 is the disease name for the disease caused by the novel coronavirus that is taking the world by storm. So I first gave a similar presentation 3 weeks ago of this particular situation to all of the emergency management here at Chatham County. This was my updated presentation for the Board of Health on the 23rd of March so that the Board of Health could keep up to date with what is ongoing with this particular disease and to discuss and try and come up with solutions to some of the unique problems it's going to present. So 3 weeks ago, this was my initial conclusion. At this time, we were still hoping that here in the United States, we could not see any profound implications from COVID-19 due to our containment measures. Unfortunately, through the information that you are going to learn about the virus that causes COVID-19, I was able to start off right off the bat with this conclusion that unfortunately, despite all of the containment measures that we were implementing, that local community transmission was inevitable. And so what we really needed to do was figure out how to protect the people most at risk. So unfortunately, here, this is 3 weeks ago. Here we have 3 days ago, and so you can see that I was proven right. Unfortunately, this disease is now community spread throughout the United States and throughout most of the countries in the world, regardless of whether or not they have cold climates or warm climates. So here we are from yesterday in the United States, looking at the spread of cases pretty much throughout the country. So our overriding objective at this time is to protect the individuals at the highest risk of significant morbidity and mortality. Now, morbidity means disease and mortality is death. So we are trying to prevent or protect people from getting the most disease or the most death through our different public health measures. So the first thing we have to do is to identify who's most at risk. So here you have age groupings looking at the percentage of death rates from China. So more or less, once you get above the age of 50, your death rate goes up exponentially. Unfortunately, that is exacerbated by any pre-existing conditions, particularly those that are related to the respiratory tract or to the cardiovascular system. So any kind of heart condition, high blood pressure, chronic asthma, chronic bronchitis, smoking, any sort of immunocompromise relating to cancer drugs, all of these things increase your risk of death. It is really important to note that at this time, children under the age of 10, we are not seeing fatalities. That is not to say that they don't get this disease and not to say that they can't spread this disease, but in a presentation that is unfortunately very doom and gloom, this is our one shining moment that at this particular moment in time, children seem to be spared from the worst of COVID-19. Unfortunately, that is not true for our healthcare workers. So they are on our list of the people that we need to be protecting. Right now, they comprise about 10% of the Italian cases, which is about 6,500 cases and 3,700 in the area of Lombardy alone. If you were to adjust this proportionately to North Carolina's population, that means that we are going to see 1,200 cases of healthcare workers being infected here just in North Carolina within the first month. So here's an unfortunate second conclusion that I have been able to make, that we are going to see hospital inundation. We're going to overwork our healthcare system because the healthcare system is designed for not your global pandemic that happens once in every 100 years. It's designed for what we normally see every year. I'm able to draw this conclusion because of the way that the virus behaves, and the fact that unlike what happened in South Korea, where they were extremely proactive in their testing and their isolation and their quarantines, here in the United States, we have had a lot of issues with inadequate testing that unfortunately has misinformed the public about exactly what this disease is, how it spreads, what makes you safe, etc. So we are going to talk about all of those things in this presentation, but that gives us a second objective. So our other objective at the Chatham County Board of Health is to figure out a comprehensive plan today to identify the resources that we're going to need and to train the additional staffing before the hospitals look like the one on the left, which is Italy, and the one on the right, which is China. So the way we do that is we know our enemy. So I'm going to go through some basic coronavirus biology for you. I'm going to try and keep all of my nerdy thoughts about it to myself and give you the bare minimum of what you need to understand. Then we're going to talk about what makes this disease so unique. We will compare it to the flu. I know there's been a lot of comparisons in the media, and because everybody is very familiar with the flu, I think it's important that you see the differences. And then we're going to talk about some of the things that are really going to hamper our ability to mitigate or stop the disease from spreading here in North Carolina in particular. So again, our objective as the Chatham County Health Board is to come up with a plan now to identify the resources and train the staffing that we need to assist the hospitals and the first responders so that we can then protect and treat the individuals in our community who are most at risk. All right, biology. Coronaviruses, it's a very large title for a large number of different coronaviruses, in the way that weather is a word that describes sun. It also describes rain. It might describe thunderstorms or tornadoes. So it is a single-stranded positive sense RNA virus with 300,000 nucleotides. And for those of you who much preferred PE or perhaps literature, what that basically means is it is big and unstable. Okay, so you remember the DNA helix. It is paired. So one side of the helix has a protein that must match with the other side of the helix. And if it doesn't, then there are mechanisms for the body to go back and say, oh, this was a mistake, let's fix that. Unfortunately, RNA is perpetually single, and so it makes more mistakes than the DNA replication process would. So that is why we call it mutable. Mutable means the ability to mutate. So we see that mutation in two different ways. You see the mistakes in general replication, which are called genetic drift. And then you also see a different form of mutation with RNA viruses, and particularly these coronaviruses, where if an animal or a person is infected with more than one kind of coronavirus at the same time, the two viruses can meet up for a one-night stand and actually exchange a bit of RNA, and then, sort of walk away from that encounter as a completely new virus that behaves in a different manner. So that is really, really important to remember for this coronavirus that is novel. That's how we ended up with it. So we had, some coronavirus that was already established in a animal population that met up with a different coronavirus, and somehow we have now ended up with this new novel coronavirus that causes the disease COVID-19. So what makes it so unique, and why are we having such a hard time controlling this thing? So the first thing that people need to understand about the virus that causes COVID-19 is that it has an incredibly prolonged incubation period. So the average is 6.5 days from becoming exposed to having symptoms, but it can be anywhere from 2 to 14 days, and that covers the vast majority of cases. And then there's always epidemiologic outliers, which basically means that most people conform to this kind of disease progression, And then every once in a while you have that weirdo who gets it immediately after being exposed, or the person with the really strong immune system that fights it off until day 27. Why is this such an important thing? Well, with a long incubation period, it really, really matters because this is infectious during the asymptomatic incubation period. In fact, there are studies that are out now that say that it is actually most infectious while you're asymptomatic, somewhere between 48 and 24 hours before your symptoms show up. The thought process behind that is that this virus is spread mainly through the upper respiratory tract, and then the symptoms come in from your lower respiratory tract. So as you are infected in your nose, in your mouth, in the back of your throat, that is where the virus is most easily spread as you wipe your nose or accidentally sneeze because it's got there's pollen on your car. And then you can spread it before it has the chance to move down into your lungs where you actually feel the symptoms. So it is spread through aerosol and droplet. So droplet are those big snot burgers that come running out of your nose when you sneeze. Aerosol are sort of tiny, minute particles of fluid that can hang in the air. A little bit like the must that you might smell at the gym. Gyms smell musty. There's particles in the air, but you just can't quite see them in the same way that you can see a sneeze spread across the room. Fomites are the other really important thing, and fomite is a fancy word for surface. So your classic surfaces are doorknobs and elevator buttons, but ironically enough, just about anything that you touch can be a surface. So your dog is a surface. If you cough in your hand and then pet your dog, or if you let your dog lick your face, your dog is not going to get infected with this disease, but they could still then spread it if somebody else pets your dog and then sticks their finger in their mouth for some reason. There is a question of whether or not it is fecal-oral spread as well. We are able to find this virus in feces of people who are infected, but thankfully because of general hygiene and public sanitation here in the United States, that is not a mode of transportation that we are currently investigating. It is also worth noting that it is infectious while you are symptomatic. So even though you might be more infectious when it is sitting in your upper respiratory tract, if you are coughing, that cough comes from deep in your lungs and certainly can be spread out into the environment. So talking about how long that virus shedding occurs, so the median, which is the largest number when you look at it on how many days in a population, is 20. So most people who get infected with COVID-19 are able to shed this virus for about 3 weeks. And that's a really scary number because that's one of the reasons that it is so hard to contain. You have people who don't feel bad that are running around and still shedding this virus. It's also worth noting that in people who survive this disease, it doesn't have to be just 3 weeks. The largest number that was recorded in China was 37 days, which is obviously more than a month. And again, that's a really terrifying number. So one of the other things that we look at is how long does it live in the environment? It lives in the environment somewhere between 1 to 3 days. And that is related to a number of factors. It is related to what part of the environment is it living in. It will probably only survive floating around in the air for a couple of hours. But it survives on a cardboard box, like your cereal box that you pick up at the grocery store, for about a day. And then on other surfaces, it can actually last a bit longer. So realistically, you need to be thinking about all of these things that you touch every day and saying, has anybody else touched that in the last 3 days? If they have, then this is a surface that could potentially be infectious. What else is unique? Well, we've had a lot of testing issues. One of the testing issues is that when you test positive for COVID-19, we can pretty much guarantee that you do have the disease. If you test negative, that doesn't actually mean you don't have it. when we were talking about if the virus is living in your upper respiratory tract, so your mouth, the back of your throat, versus living in your lungs, if you are testing the back of the throat compared to testing the lungs, you're going to get different results. So the PCR tests can definitely tell us, you do have it, but they're not terribly sensitive for saying if you might have it. And there are some statistics down there. So a BAL is a bronchoalveolar lavage, and that is basically, it's a sample of the fluids deep in your lungs compared to your nasal swabs, which are one of the most uncomfortable parts about testing, and then the pharyngeal swabs, which is basically the back of your throat. So getting fluid from your lungs is a much more sensitive way of finding out if you have it, but that procedure in people is typically done at least under sedation, if not general anesthesia, so it's not a good way to test the general public, which is why we're having some of these false negatives coming about in the population. I know there's a lot of people out there who are terribly concerned with exactly what number of cases are in exactly which locations, and this is why this is such an important issue. It's because as much as those numbers might be comforting to you to say, oh, well, I know that Chatham County only has 3 official cases, it's not actually an accurate representation for the number of cases in the county. And then the second half of that is because the testing criteria are restrictive. And while I genuinely wish that every single person in America could be tested every day for this disease in order to stop it in its tracks, that is terribly not practical. We don't have the materials. The people who are doing the tests need to be in protective equipment in order to protect themselves, and there is a shortage of both of those. So when we talk about the disease progression, healthy people who are able to fight this disease off typically get better in about 2 weeks. But unfortunately, people who have trouble fighting this disease may suffer from 1 to 2 months, and they could spend a good portion of that time in the hospital. As we talked about earlier, there is a lack of serious disease and death in infants and in children at this time, which is something that we are truly thankful for, but don't truly understand why yet at this stage. It is worth noting for all of the people who are not millennials, that are in the generations below us and still actually in school and on spring break, that unfortunately young healthy patients are actually getting very, very ill with this disease. There is currently a preteen in Georgia who is on a respirator because of that. So please use caution. Remember that just because you feel healthy and you are young, that does not mean that you will not get sick from this disease. So how is it different from the flu? This is both my favorite and least favorite question of the day, because there's been a lot of societal misinformation relating to the fact that this disease is just like the flu, so why do we care? So let's talk about how infectious it is. The R0 is the general science standard for what is the rate of infection spread, and that basically means if I am infected, how many people am I likely to infect, and then how many people are they likely to infect. So right now, the infection spread rate of the novel coronavirus is somewhere around 3, but we really don't know. There are some newer reports out that are suggesting it's closer to 5. Comparatively, that is only 1 for the flu. So if I get the flu, I'll give it to 1 person. But if I get COVID-19, I might give it to 3 or 5 people. And how do we determine this number? Well, it's based off an awfully large number of factors, including how quickly the virus replicates, how long it lasts in this environment, whether or not it is shed symptomatically, what the incubation period time is. But the take-home point is that right now, the number of cases in the European Union, in Australia, and in the US is 3 days. So every 3 days, the number of cases we have in the US doubles. And that's really terrifying because currently our caseload is in the 40,000s. So in 3 days, it's going to be surpassing China. And that's something that if you like numbers, that's an unfortunately scary number to be looking at. One of the other differences is how many people need to go to the doctor or need to go to the hospital because of the coronavirus versus the flu. So for COVID-19, we see about 20% of cases having moderate to severe pneumonia and 10% of those with the severe pneumonia needing to go to the hospital. Okay, that is compared to 1% with the flu. So not only does it spread faster to more people, but it causes much more serious morbidity. And remember, morbidity is disease. So talking about mortality, it also has a higher mortality rate. And the mortality rate is fluctuating wildly between the different countries that it's in, with their different testing reporting systems and the different populations that they have. So if you looked at the mortality rate in South Korea, where they have an incredibly high number of tests ongoing, it's down to 6.6%. Whereas if you're looking at the mortality rate in Italy, right now it is somewhere around 10%, but again, they're utilizing their tests for the people who most need them, so it's probably lower than that. And the global average is about 2. The mortality rate comparatively for the flu is 0.1%. So that means that the coronavirus is somewhere around 20 to 50 times more deadly than the flu. It is really, really worth noting that for the flu, in the face of a very bad outbreak, there are vaccinations available. So yes, right now, current globally, more people have died from the flu because it is already everywhere. But unfortunately, COVID-19 with its infection spread rate will soon be everywhere. And then you're going to see a much higher number of people who have gotten sick or passed away from this disease. So just when we have it all figured out, we have to worry about mutation. Mutation is already happening because of the things that we discussed back at the very beginning with the coronavirus biology. It will happen frequently in the course of global spread. And whether or not it becomes more virulent or less virulent, which basically means if the disease is more bad or less bad, is related to how dense the population is and what the health status of that population is. So the reason that there's a picture of African countries that have confirmed COVID-19 cases below that is that, unfortunately, now that it has spread to Africa, where there are very, very dense populations of people who have pre-existing conditions that will predispose them to being ill from this, we would expect to see this to mutate in a more bad way. And then here is proof in the pudding that we already have mutations in the coronavirus. The vast majority of these mutations at this stage are the point mutations where it just makes mistakes every time it replicates. So what are we doing? How is the Chatham Board of Health protecting you? And what can we do to treat it? So it's really important to understand that isolation and quarantine aren't going to stop this. They serve to slow it down. But slowing it down is really, really important because the slower we can make this move across our population, the more likely we are to be able to treat everybody who gets sick. It's really important that we talk to you to make sure that you have all of the information that you need to have and none of the false information that's floating around the internet on Facebook or on MySpace or on Twitter, whatever fun internet things you can find that I am now too old to know. So what are we doing? The first thing we're doing is social distancing and basic hygiene. So you've seen all of the different memes about washing your hands. My personal favorite is the T-Rex is extinct because he couldn't. And then we have harped and harped and harped about the social distancing. So let's talk a little bit about what kinds of social distancing there are. So option 1 is complete lockdown. This is what we saw in Wuhan, China. It's also what they're doing in the worst affected areas in Italy. The expectation is if you completely shut down people moving around, nobody can transmit it to anybody else. But because it has a long incubation period, we then have to sit there and wait for everybody who might have already been exposed to it to get sick. So you don't actually see how many cases are available or are in the environment until 2 to 3 weeks after a complete shutdown. And unfortunately, that's just the peak of the cases. There are still cases that are going to happen after that 2 to 3 week period. Say one person in the household was exposed, they got sick at the 2 to 3 week time period, but they exposed their family member in that house at some point during those 2 to 3 weeks. So in actuality, in order for this to be effective, you're looking at a minimum of 2 months of a complete shutdown in order to stop it in its tracks. If you end that shutdown early, people start moving around. The people who haven't yet been identified as having it then spread it to other people, and we then see more cases in about 2 to 3 weeks time period. It's really worth noting that social acceptance of this in a democracy is a whole lot less likely to be appreciated and maintained than in an authoritarian regime where they can simply say, this is what you are doing, and you do it because we said so. So what are we doing here in the United States at the moment? We are doing the second version, which is a partial shutdown, trying to slow the number of cases. Unfortunately, for this to be truly effective, you really need to think about this disrupting society for a much longer period of time, because again, we're not stopping the spread completely, so it's going to take longer for everybody who's walking around possibly transmitting it to finish possibly transmitting it. And the number one thing that is really going to hamper this is job security. And we are super appreciative of that. I am a small business owner. It is entirely possible if we have a significant shutdown for 4 to 6 months, then my business will go under. So we are talking with everybody that we can, seeing what options we have in order to protect your job and your ability to feed your children, at the same time of trying to protect those who are more likely to get very sick from this disease. I'm also going to point out that cabin fever is likely to hinder our ability to slow these cases. So I'd urge you, please, I know it's tough, but if Anne Frank could hide in a tiny, tiny little room for months on end to try and protect herself and her family, then hopefully you can hide in your house and step outside, but having very little interaction with anybody else in your neighborhood in order to protect yourself and your family. Whether or not we can maintain this sort of behavior until vaccination is a very big question mark. The earliest vaccine availability is still 2021. Unfortunately, the way that we make vaccines is to make sure that they are safe before we give them. So we can't just take a vaccine that we think might work and give it to everybody. What you'll find out then is either the vaccine doesn't work or it's not terribly safe. So it's got to go through the normal protocols, and people are working very aggressively at this around the world, but it's still going to take time. There's been a lot of discussion about herd immunity, and herd immunity is a concept of if 7 people in the room have already had the disease and have stopped shedding it and are completely healthy, then that 8th person in the room who was never exposed to it should be safe because they're surrounded by the people who have already had it and aren't shedding it. But that is related to whether or not those people have a long-lasting immunity to this disease, and we don't necessarily know that yet. The virus has not been around long enough for us to say if it's going to be like a tetanus vaccine where it lasts 10 years because your body responds very well to the tetanus vaccine, or if it's going to be like the common cold where you can get the common cold multiple times a year because your body just doesn't build up an immune system response to the common cold the way that it does to some other diseases. We don't know if it's possible to get infected with more than one COVID-19 strain as it continues to mutate around the globe. So whether or not this turns into something like the flu, where every year it's slightly different and every year it runs through the community, we just don't know yet. So what can we do? The nice thing about this is that it responds to standard decontamination. So dilute bleach, hydrogen peroxide, soap, all of the things that you like to clean with should be very effective at removing the virus from surfaces. When you're in the hospital for COVID-19, the things that we expect to treat you with would be oxygen therapy and ventilators. Prophylactic antibiotics. Antibiotics will not stop this virus, but they will help to protect you from getting a secondary bacterial infection while your immune system is battling the virus. Antipyretics, that means something to treat your fever. Acetaminophen is the drug of choice for that. That is Tylenol here in the States, or paracetamol if you are in one of the British nations. Systemic support, that's going to be IV fluids, somebody to, take care of you, bring you blankets, take the blankets off, whatever it is that is necessary. There have been a lot of people discussing antivirals that have already been made for different viruses, and can we use them against this one? We are trying them, but it is really important to understand that that's not going to be a cure-all for the general population. And it's not going to be a cure-all for two reasons. One, because the way that viruses replicate is by hijacking your cells and using your cells to make more of themselves. The only way to stop that is to slow your own cells down. Now, obviously, that might have some bad effects for you, so all of the different antivirals that we use are very, very specific about which part of your cell's replication process they slow down in order to try and attack the virus without attacking the main parts of the way that your cells work. It's a little bit similar to when you have chemotherapy to kill the bad cancer cells. Unfortunately, some of the good cells also end up getting damaged or destroyed in that process. So it's a very, very nuanced way to treat a virus, and it's really only going to work in very specific circumstances. So last time I gave this presentation, I talked a lot about how to protect the healthcare workers. We are already doing all of those things, so I'm not going to be addressing those today, but I really do want to address the next biggest problem, which is going to be the healthcare shortage. And I happen to love this meme because I'd like to think that a gynecologist who can place a very small catheter into a very small urethra is probably quite capable of placing a larger tube into your trachea. My recommendation to the board and to the world is to hire additional help before you get swamped. If we are trained before the hospitals are inundated, we're going to be better at effectively fighting this disease. So where are we going to find those people? And that is up for debate. So some of the things that other states and other countries have tried are calling in the retired. Some of them have looked at graduating final year medical students early. And then what I'm actually going to recommend to the board, and what I have recommended, is to temporarily authorize non-traditional clinicians. And the reason for that is that the retired comprise the population we're trying most to protect. They're the elderly, they're more likely to have significant health problems, and so what we'd essentially be doing is calling on their civic duty, and I haven't a doubt that they would all respond, but then we're going to put them at much higher risk. Final year students don't have the clinical expertise that your 10-year clinicians do. So while they will absolutely be of use, it's not going to be a 1-to-1 ratio, it's not going to be a 1-to-2 ratio, and it still takes time for the clinicians who are already overworked to train them in what we need them to do. So that's not going to be as equivalent as using other clinicians that have lots of personal experience, like veterinarians, like dentists. There's a large number of us in North Carolina There's 4,500-ish veterinarians and 6,000, not 7,000, dentists. Many of us run small practices, and a lot of these small practices are donating their protective equipment to the hospitals for their usage, which means that we are not doing the kinds of elective procedures we would typically do. So I am calling on anybody who is in the legislative capacity to pass an amendment similar to our ability to help somebody on the side of the road that says, in the event of this global health catastrophe, licensed doctors such as veterinarians and dentists can work alongside of traditional human clinicians so that we can create a team effort to provide the health care to the patients in need. And I'm not saying that I'm suggesting that your dentist should now be doing your open heart surgery, or that your veterinarian should all of a sudden become a pediatrician. But there are valuable skill sets in all of the licensed clinicians that aren't typically found in the hospital setting that we can utilize to our best advantage. So what are some of the things that you as the public can help us with in combating this virus? This is a favorite quote of mine, and I'm hoping at least someone in the audience will recognize it. The quote is, "A person is smart, but people are dumb, panicky, dangerous animals, and you know it." So here are some examples. This example here on our left is a baby boomer who is obviously very fit. 60 is the new 40. But unfortunately, that is not true for this coronavirus. So if you are in the at-risk population, please take it very seriously. We know that you're fit. We're really impressed with the marathons and the hiking and all of the activities that our baby boomer generation is currently undertaking. But you're still at risk, and we worry about you. So take that one worry off of our list. Down there at the bottom, that is Bondi Beach in Sydney, ignoring these social distancing recommendations. Please don't do that. I think that's enough said. And then over there on the right is people stockpiling toilet paper in particular in that picture, but just supplies in general. The good news about the way that this virus works is the vast majority of people are going to recover from it. There's really no need to stockpile toilet paper. The toilet paper supply is not going to disappear, and the only reason it will disappear is if people panic and continue to buy it in unusually high numbers. So what are some of the other things that are complicating our response? Unfortunately, governmental dishonesty, and across the globe, I'm not picking on any one government. There are lots of governments you could pick on. And you understand why they're doing this, because they're trying to preserve the economy. Unfortunately, at this stage, that is somewhat of a moot point. We're all hoping that the economy can bounce right back once we have a better handle on how to combat this disease. But at the moment, it looks pretty grim for all of us. And so you can be sympathetic to why the governments across the globe are maybe not giving all of the answers that they should be giving, but it still doesn't help us as a community. Societal denial, for those of you out there burning incense and charging your magical crystals in the sun, unfortunately, that is not going to save you from coronavirus. You're far more likely to save yourself from coronavirus if you follow the recommendations of your health professionals. There's a lot of discussion amongst small businesses as to what is actually deemed essential. And I think it's really important to understand that everybody in America thinks that what they do is really important. And they're not wrong. The janitor is just as important as the doctor in the hospital. But unfortunately, the jobs within the United States that have high contact between people, unfortunately really need to scale down their operations in a massive way. And we know that that is a true hardship, and hopefully the government does a good job of supporting everybody whose business is not deemed essential. There's a large lack of information or an unfortunate inability for people to distinguish what is real from what is fake. A lot of that is related to the lack of testing, the lack of reporting on certain issues like the unemployment. I am a doctor. I'm not an economist. I'm not a reporter. I don't have an answer except for to say that we recognize that it is a problem. What is another stumbling block? Societal panic. For everybody out there who's been hoarding their surgical masks. Surgical masks work in a very specific way to prevent the snot rockets from the people wearing them from shooting across the room into your vicinity where you might get infected. They will not protect you from this virus. They are meant specifically to help someone who is symptomatic from spreading it. So please donate them. If you purchased way too many, give them to the hospitals in need. It is going to have a major effect on the way that the hospitals run in a way that we absolutely can't quantify. Same problem with everybody here who's been buying their milk sandwiches. We do that every year when there is a snowstorm. We're not going to run out of bread, and we're not going to run out of milk. The farmers, a lot of them are very isolated on their farms. They're unlikely to stop milking their cows. So buy what you need. Don't buy more than what you need, because it's just going to go bad. There are some other social stumbling blocks that I will not be addressing right now. Religion, racism, people retaliating against animals because they feel like the animals gave us this disease. That is 100% above my pay grade, but it is important to recognize that those are issues that we are looking at. So here is where I opened up my presentation for questions and discussion. I'm not going to kill you guys with my impersonation of our favorite Bond there, but if you do have questions relating to this presentation, send us an email, send us a message on Facebook. We are listening. We will be doing routine updates for the public in order to have you be as informed as possible. So I hope this has been helpful and not too terrifying. And once again, I am Dr. Stephanie Freese with the Chatham County Board of Health.